Hello and welcome to this edition of EC3 HOSA Medical Moments. This is a special edition because, for one thing, we don't have any of our HOSA students hosting it because as a department of the Hardin County Schools, HCEC-TV, even though we do have student producers, today our students are at home learning through non-traditional instruction. But today is special because joining me is Terry Bergen. She is the Public Information Officer for the Lincoln Trail District Health Department. And she's going to tell us a little bit about the role of the health department, what everybody needs to know, and that day to day things are changing. So Terry, first, thank you for joining us today.
You're welcome.
And as you can see, we are practicing social distancing. And no, I'm not yelling at Terry. It's just that we are at a distance from each other. We want to make sure that we model good practice.
That's exactly right.
And that's really critical. But before we jump into ways to protect or kind of sanitize ourselves a little bit better, what is the role of the Lincoln Trail District Health Department in this situation, and how many counties do you oversee?
Well, Lincoln Trail District Health Department has 6 counties. And so we're talking about Hardin, LaRue, Nelson, Marion, Washington, and Meade. Those are our service areas. About one of the things that we do on a daily basis that people may not be aware of is that we are experts at communicable disease investigations. We receive over 100 different communicable disease reports from local providers all over our district that we have to investigate, whether that be pertussis or varicella, chickenpox, or tuberculosis. All of that communicable disease we do. We have a lot of practice at that. So this is just fits into what we do already. The only difference is that it's new. The coronavirus or the COVID-19 is just new to all of us. So about 2 weeks ago, we implemented our Emergency Operations Center. And in that center, we have different skill sets to manage and take care of different parts of the investigation or the process that's happening right now. For example, we have somebody on the epidemiology team. So if we had to go out and do a contact investigation and call these people who might be a contact of the primary case, and then call other people who need to be self-monitored, these are the people that do that. We have the public information officers. Myself and Melissa Phillips are in that role right now. We're the ones that are providing guidance. We do the press releases. Now, when I say guidance, I mean things like we have created literature for churches as far as what they should be doing right now. We just finished guidance that we'll be sending out today for drug rehab and treatment facilities that will be going out to them, that type of thing. We try to stay ahead of anticipate what individuals may need or be looking for during this time. Our preparedness manager is in there as well. So he is responsible for an example, supplies, PPE, masks, personal protective equipment, okay. All of that type of material or supplies. He's responsible for that. Now, I say that, and I need to add a little amendment to that. It doesn't mean that he has some on hand, but what he does do is he kind of coordinate what's available at the state, if possible. For example, we had some that come in yesterday, and he made sure that those supplies got to the necessary facilities. So he helps in that type of vein. We have a epidemiologist in there who's tracking everything, making sure that we know where the cases are all over the state, and if we have here, it's on a map. You know, she does all of that stuff. It's just a lot of different skill sets in one room, and they all come together, and we meet 8, and our days have gotten a lot longer. I mean, last night we were there at 8:30, and so our days, depending on what's happening during the day, can be shorter, and our shortest day is around 6:37 or longer.
And I'm assuming it also includes weekends. So
yes, our work week has extended to Saturday. We hope it won't get to Sunday, but right now it's 6 days a week.
Okay. Mm-hmm. In this area right now, currently in our district, our health department district, we know that we have a victim in Nelson County. And I say victim, but we have a client in Nelson County that's tested positive. And by the time this airs, there's going to be others.
There may be, yes.
And basically, we need to know that it is in this area. So what do we need to do as individuals to prepare for this or to monitor this?
I'd like to start by saying a lot of people, I don't know if this is the common theme, but I think people may be feeling safe that we don't have a positive case announced in Hardin County yet. And so because of that, we may go around like business as usual. The first case in California that was a community case should have been like a red flag for all of us. That told us that the COVID-19 was in the community. And so we know it's here. Even though you have not been tested, does not mean that you have not already passed by someone who has COVID-19, because we know that 80% of the people who have it have no symptoms or mild symptoms. And so you could have unknowingly come in contact with someone. That's why we are really stressing that people stay away or avoid, like the governor mentioned yesterday, avoid crowds. You should not be in a crowd. He said all gatherings pretty much need to stop. So if you are 60 and over, and if you have a communicable compromise, if your immune system is compromised, you really should not be leaving your home, if at all possible. If you must go, maintain that 6 feet distance. Everybody should start avoiding crowds now. And if you have to go, stay 6 feet apart, 6 feet away from each other. Mm-hmm. Did I answer your question? I feel like I got off on a little tangent there.
Well, we're going to get into further details about how to protect yourself, what kinds of things you can do, but the 6 feet is really key.
It is really key. And a lot of people think that some of the things that we're saying, I don't want to say a lot of people think, some of the things that we're saying are really simple, but they're effective, and we know that they work. The social distancing 6 feet, I like to give you an example. The 1918 pandemic flu, and you may have heard the governor talk about this on several occasions, but we know that in Philadelphia during that time, they were warned by infectious disease professionals that the flu was in their city and that they really needed to practice social distancing. But that warning was ignored, and they had parades, and they did the large gatherings, and they didn't avoid crowds. And within 48 to 72 hours, people started to get sick. And because of that, over 16,000 people died because they did not heed the advice of the professionals to do social distancing. Now, if you look at St. Louis, they did the exact opposite. They closed schools, they closed businesses, everything that the governor's doing right now, they did. As a result, their mortality rate or their death rate was only 2,000. All because they practiced social distancing, avoiding those crowds. So we know it works. And it's so simple. That's what's so amazing about this. We have a tool that's really powerful. We know it works, and all you have to do is keep away from somebody 6 feet or more. The other thing that you can do is stay home if you're sick. I realize people have to go to work. but stay home if you're sick. If you're in your office, you need to practice that social distancing. I am going to keep mentioning that. I'm sorry.
Oh, we've got to hammer it home.
Yes, it's very important. Of course, these are things people should have been doing already, with coughing into a tissue, throwing it in the garbage, washing your hands for 20 seconds, warm soap or water. If water is not available, and let me say this, washing your hands with soap and water is the preferred method.
Okay.
Hand sanitizer is your second choice. Soap and water is very effective, okay? But if it's not available, and you may be in places where it may not be, 70% alcohol hand sanitizer works as well. But when you get to a place where you can wash your hands, make sure that you wash your hands. You need to avoid, as I mentioned before, those adults who are 60 and over, and people who have those immune compromised situations, because they suffer the worst from this. And so they need to stay home. They need to make sure they have enough medication to cover them while they're at home. People who are going to visit grandparents, like, for example, younger people may not know they have it, and because of the mild symptoms and things that I mentioned earlier, they may go visit their grandparents, unknowingly pass it, and they end up getting sick. We don't want that to happen. And I know it's hard to stay away from family members, but call them. I think the governor actually showed a picture yesterday on television where there was a grandmother who was at an assisted living home, and she was standing on her back patio, and her family came to see her, but they were way off. But they got to see her, right? Practicing that social distancing, to protect them and to keep them safe as well.
Yeah. Mm-hmm. Also, what about surfaces? We know that at first it was about just person-to-person contact, but now we know differently that the virus, it's got touch on practically everything, right?
Yeah, it can be on surfaces, and what we're recommending people is not to panic as far as that's concerned, because what you're using right now works. So what you would normally use to clean your home, continue to do that. What you would normally use at work, continue to do that. Just clean those surfaces that are frequently touched more often. You might want to up that up a little bit. Yeah. So doorknobs, light switches, cabinet handles, computer keyboards, those type of things that might be touched a little bit more often than other surfaces. Yeah.
For those stores and businesses that remain open, that receive customers daily, such as our big chains and things like that, of course we need them. Mm-hmm. Do you have a role in helping them prepare or to take care of what they need to do?
Yes, we are actually putting together guidance today for what businesses should and should not do. And hopefully that will go out sometime today. But, the governor has closed a lot of businesses down. And so there are many that we will not have to, that won't have to worry about this, because they're keeping their employees safe by keeping them at home. So for those that are still and remain open, we will be sending out some guidance for that. Mm-hmm.
We have talked about that this is really susceptible by older individuals, yes, or individuals that their immune system is compromised. But we know now, in Kentucky, we have an 8-month-old that tested positive, and yesterday a 6-year-old. So it can affect those students or those children. Is because they are younger and not, if their immune system isn't compromised, there's always a good chance that they may come out on the other side no worse for the wear?
Well, you know what? As I mentioned earlier, the ones that are most severely affected by this are the 60-year-old. They have the worst problems. What's great about the younger children is that it was never said that they, we have focused on those who are 60 and over, but we never said that the younger ones would not get it, right? There's a possibility that anyone can get COVID-19. What's great about the younger ones is that they're really resilient, and they usually fare a lot better than others. The governor had put up a graph yesterday on his news conference showing that when you look at those who are 19 and younger, they do really well. Hardly any of them need to be in the ICU or anything like that. It's just a matter of the virus running its course, and then they get to go home if they're not self-quarantined at home.
So I had asked you earlier about individuals that wanted to be tested.
Mm-hmm.
What do you recommend? Do you just, if you're feeling a little bit odd, just wait it out, don't even worry about getting tested? Or should you try to pursue that? And what would be the defining note? Oh, this is why I need to be tested.
Well, there are 3 categories that we go by when people should seek care. One is the worried well. So you have individuals who are worried, but there's nothing wrong with them. We've had calls where we've had individuals say, hello, I am a person who was in contact with my boyfriend, who was in contact with a sister, who was in contact with a mother, who got tested for COVID-19, but they don't have any symptoms. That's not a close contact.
Got it.
And they really, according to our current definition, they are still very low risk for getting tested, okay? So a close contact is someone who has come in contact with a confirmed case of COVID-19. So it's confirmed, no doubt. They have been in their presence for at least 30 minutes or longer. That is an opportunity for a person to cough or sneeze, because COVID-19 is passed by respiratory droplets. So coughing or sneezing on you or close by you in the air there, because those germs project a little bit when you cough and sneeze. And it landed in your mouth, your eyes, your nose. That is what we consider a close contact. If you happen to walk by a person in the hallway, that does not count. If you happen to be in the same room as a person for a few minutes, that does not count. So worried well, I think, kind of falls in that category a little bit. So you really don't need to get tested. The next one is the next category. Hold on a minute here. I have it here. You would think I would know this by heart. Is feeling ill, but otherwise would not have sought out medical care. So what that means is that I've got a cold. I would not normally go to the doctor for a cold. So we're asking you to kind of do the same thing. And I realize that the symptoms of COVID-19 is close to the symptoms of a common cold, right? But if you're feeling fine, there's really no need for you to go if you would not otherwise have went to the doctor anyway. COVID-19 really shouldn't change that. Unless, and I'm going to talk about this in the next category, your symptoms are worse. And worse meaning shortness of breath. You start having some really bad respiratory issues. Then you need to seek care. Call your provider, and then he will direct you as far as what you need to do. Now that category is if you're sick and you feel you have an emergency. That's when you need to seek care. What I want to stress too, Gina, is that we know that it's in the community already. People probably have already been exposed to this. They just don't know it. 80% of the folks that walk around now have it. So there's a good chance that you've already walked by someone who has it. You do not need to get a COVID-19 test to tell you to do the right thing. And that means that social distancing and staying at home and avoiding all crowds. The governor said yesterday, all crowds should be avoided. None should be happening right now.
Now, some people would say, well, what's a crowd? How is it defined?
Well, as of the day before yesterday, it was 10 or less people. So right now, a crowd would be anybody more than you. Now, it doesn't mean your immediate family. If you live in, whoever your household is in your home, we're not talking about that, right? We're talking about strangers, people that you don't know well, business associates, that type of people. You really should avoid contact with people. I think maybe that's a better way to say it. If you are not with your immediate family, all other people should be avoided right now.
Of course, we know that our healthcare providers and our emergency management people, first responders, have to do that.
Yes, they do.
They meet strangers that's their job.
Yes.
So what do you do to support them or to tell them, what they need to practice?
Well, the Centers for Disease Control has specific guidance for our EMS emergency management system for those folks that work in that role. We work in conjunction with them to try to provide as much guidance if they need it related to what they are doing. But they're experts in what they do. They really don't need our assistance in, going out, taking care of people. They got that. If we are able at all to supply them with those supplies that I mentioned earlier, then we could assist them more in that way, I think, than anything else.
What about supplies? You hear this one will say, well, we don't have this, but we have this. What's the supply chain look like in this district's health department? Well,
things are just very limited everywhere. A lot of individuals have panicked, and so they're looking for face masks and N95 masks, and that has really, I think, hurt our supply system for those who really need it, right? CDC is recommended, Centers for Disease is recommending that you don't need to wear a face mask if you're not sick, because it's not going to protect you from COVID-19. The masks really need to be reserved for those who are really, really sick. They need to put it on so that it is not, it kind of provides some protection from them giving it to those who might be well. That's the way it should be. So the supplies that are available here, we do have some. We've given that to the organizations that are on the front lines, providers, hospitals, that type of stuff. We've tried to help supply them in that way. We're more of a conduit, I should say, as far as the supplies are concerned. They basically bring them to us, so they're given to us to the state, and then we make sure they get in the right hands. It's not something that we have stored at the health department to give out. I do want to stress that. But we act as a conduit from the state to get those supplies into the hands of those who need it.
For those who do not have a regular provider, healthcare provider, they for whatever reason, maybe indigent or living below the poverty level, or what can you tell them?
Well, the governor has made it available that everybody that needs to apply for Medicaid can. He made that announcement, I think, several days ago. They need to go to the KYCOVID19.ky.gov website, and all of that information is on there on what they need to do in order to apply for Medicaid. Okay?
That's amazing.
Yes.
I was going to say that every day at 5, it's like I want to watch and see what my governor is presently saying.
And I think doing a great job.
That's what I was saying. I think that he's done a terrific job getting down in front of it, because at first everybody was like, oh, it's just a cold. It's just a flu. Why are we doing this? We're overreacting. So, and no matter how much you talk about, there's really big reasons why, and we see the consequences is what Italy is experiencing.
Yes, that's exactly
when
right.
you have over 200 deaths a day.
Yeah, that's
and
right.
You're losing an entire generation of individuals. And then you have that fear that you could have caused that. In the next few weeks, we will probably get to the point that we no longer can trace people back to that initial contact.
Oh, I see what you're saying. More to travel,
Right.
that type of stuff, yeah.
Well, so in that few weeks where individuals prove positive, it's harder to learn that, to follow that chain of where it first originated. Is that accurate in saying?
Well, I would like to say that we are already starting to move away a little bit. Although we screen for travel history, because we already know it's in the community, that will become less and less of a criteria, I want to say. We won't focus on that part as much. Maybe that's what I should say. The question will still be asked, but because we know that it's already in the community, we will focus more on who you've come in contact and how can we prevent the spread from here.
You mentioned the COVID-19.gov website. What are
Yes.
some other websites or phone numbers that people need to know about?
Well, if you want to call, there's a public hotline at the state that you can call for any type of question you have about COVID-19. That's where you need to call. Now that number is 1-800-722-5725. You can also check out our website. Lincoln Trail District Health Department has an awesome website, and we try to keep that as up to date as possible. And that is it's our initial, so Lincoln Trail District Health Department. So ltdhd.org is our website. Now, Hardin Memorial Hospital has opened up a hotline for those areas in which they serve. Okay, and so if you have symptoms, that's the caveat here. If you have symptoms, then you can call this hotline. And that number is 270-979-7777.
Awesome. I was going to say 30 minutes has passed fast.
Oh, let me give you one more number, okay?
Right.
We're getting a lot of calls about this business is not closing, this restaurant's still operating. There is an environmental enforcement line that you can call to voice those type of complaints. And that number is 270-982-7040.
Terry, I know that the Hardin County Schools has used Facebook Live to connect to parents and the community, but you all also have extended your service to Facebook Live. Tell us a little bit about that.
Well, I want to make the public aware that every Wednesday at 6:30 p.m., our director, Sarah Jo Best, will be doing an update for the community on what's happening with the COVID-19. Just go to the Quixie Radio website, Quixie Radio Facebook page, and you can watch it live.
That's awesome. And then it'll later be posted on
our webpage, the ltdhd.org webpage. If you happen to miss it, it'll be there.
Awesome. Well, thank you. That's another way of getting information out to the community.
Yes.
Okay, Terry, thank you so much for coming in today.
You're welcome.
We could talk more and more, and we probably need to have you back in a couple of weeks.
I'll be glad to come back.
And just to kind of give us an update of where we are and what our next steps are, because we know it's going to go past the first 2 weeks and 3 weeks and 4, and it may even get into closer to the end of May and possibly later. But
yes, people need to hunker down.
I was going to say, we're going to be on this journey for a little bit.
That's exactly right.
New norms every single day. It's like, oh, well, that's new.
Yes, yes, it is.
Well, thank you, Terry, for
You're
coming
welcome.
in, and all that the health department does. I mean, it really does provide a calming effect for those of us that have to be out in those trenches and get that information out to everyone else.
Yes.
Right.
Thank you for having me.
And thank you for joining us for this special edition of EC3 HOSA Medical Moments.